So our next segment here, I'm really excited about this. We have some amazing medical practitioners who are joining us. We have Dr. Robin Goldsmith, who's based out of Green Bay, Wisconsin, Dr. Rusty Chavey, who's in the Metro Detroit area here, Ann Arbor, Michigan, and Dede Chism, who's joining us from Colorado. And all three of them have really been pioneers in Catholic healthcare clinics and creating a model and delivering care that is really centered on the truth of the person, the human person, and providing integral care for their patients. So I'll introduce the three of them together, and then they'll each have a little relation or a little 10 minutes, and then we'll join together for a little panel. And you can feel free to ask questions. There's going to be a session of questions and answers at the end of this. So throughout, you should be able to see a question and answer box on the bottom of your screen. Feel free to ask a question there. And so first, Dr. Robin Goldsmith is, pardon me here. Dr. Robin is a wife, mother of 4 sons, anesthesiologist. After 20 years as a physician, she retired from full-time practice to start the St. Gianna Molla Clinic and the St. Gianna Molla Guild. She served as president of the Guild, which was named Outstanding Guild of the Catholic Medical Association in 2015. The St. Gianna Clinic has a formally decreed mission as a Catholic teaching clinic by Bishop David Ricken of Green Bay. Dr. Goldsmith received various awards for her pro-life efforts, including the Pro-Life Wisconsin Activist of the Year and Green Bay Diocese Faith at Work Award. She's the president and chief medical officer of the St. Gianna Molla Clinic. Dr. Rusty Chavey is, pardon me, he's a graduate of the University of Texas Medical Branch, and he completed his residency of family medicine at the University of Michigan. And he's been on the faculty of the Department of Family Medicine at U of M since 1997 and is currently the service chief for the department. In 2014, Dr. Chavey and several colleagues founded Emmaus Health as a way to create a model for Catholic outpatient primary care, and started here in Ann Arbor, Michigan. I believe that they have a pro-life clinic connected but separate from Emmaus Health, and the goal of extending this model towards other communities throughout the country. And Dede Chism is co-founder and executive director of Bella Health and Wellness in Denver. She holds a master's degree in nursing with a specialty as a perinatal nurse practitioner from Regis University in Denver. Her career in nursing has taken her from critical care to expert medical legal consulting and serving on numerous boards. She's a founding member of the National Consortium for Pro-Women's Healthcare Centers, and which is trying to create standards for pro-life clinics across the country. So we'll start here with Dr. Robin. Thank you very much for joining us.
All right, thank you so much for that warm welcome. It's a delight to be here today. And as you all know, we've been asked to speak about problems facing Catholic clinics, solutions, and operating in a post-coronavirus world. And while these problems we are facing are many and great, the solutions are arising. And by the end of my talk, I hope you'll agree that Catholic clinics are truly the ultimate solution to this post-coronavirus world. Now, to give you a frame of reference, I would like to share a brief glimpse into our clinic, the St. Gianna Clinic, before we visit some of these current challenges and solutions. And James, if you don't mind splitting the screen for me, that would be wonderful. St. Gianna Clinic opened in 2015, and we really, at first glance, are a mainstream comprehensive primary care clinic. We serve all people of all walks of life, all faiths or no faith, the very rich and the very poor. We currently have 2 obstetricians and 2 family practice doctors, and we could flip to the next picture, please. And as a result, we're able to provide obstetrics, family practice, naprotechnology, both medical and naprosurgical techniques, endoscopic services, basic surgery assist, and much more. And as James mentioned, we were formally decreed as a Catholic teaching clinic, and we feel extremely blessed to be that, because what that translates into is that while we are expected to provide truly excellent and always faithful care, we have an equally important mission to always teach or evangelize why we believe what we believe, both within the walls of the clinic and beyond, to anyone and everyone who wants to understand how faith and medicine are intertwined. We also have a model that's very unique, where we are affiliated with a hospital system, HSHS, which has been an incredible blessing, a truly beautiful and fruitful relationship. And you can see a picture here. This is just one of our pictures of our staff on any given day. And we actually, if we flip to the next slide, this was a fun picture of most of our staff for a Christmas Facebook post. And we're an amazingly blessed group. We have wonderful nurses, doctors, and just an amazing group of committed, faithful people that truly believe in the mission and vision of the St. Gianna Clinic. And on the next slide, we are also blessed to have a chapel right within the clinic. And this is the most important part, we believe, because we know that God is the ultimate healer, and that having our Lord present 24/7 right within our clinic has been an incredible grace, both to us and to our patients' families and beyond. So before the pandemic, our clinic was a vibrant, growing practice. It was an incredible, incredible place. We served all people and had patients coming from across the country, especially for our women's health and infertility services. And of particular note was the patient experience. Time and again, patients would say to us, "I've never experienced anything like this before. I feel so cared for. There's so much compassion, respect, dignity, love." It was just nothing like they'd ever seen or heard of before. And I think the fact that we were so fortunate to receive each year since opening this National Guardian of Excellence Award was simply a reflection of our deeply held belief that every patient that we serve is a gift from God, and that it is our blessing to be able to live out our vocation in a place like St. Gianna Clinic, and that in every encounter, we truly do our very best to see Jesus in our patients, and we pray that they will see Jesus in us. And for that, we are truly grateful. Well, with the pandemic, everything changed overnight, as you can imagine. We went from this growing, vibrant practice to only seeing urgent or emergent patients after a detailed screening. We truly only saw absolutely necessary patients. And we were not seeing COVID patients. We were doing only absolutely necessary surgeries like stat C-sections or needed C-sections. Our procedures were essentially stopped, along with labs and other ancillary services. So the obvious problems were sustainability. We had not had that many challenges because of our model working with this amazing hospital system. But as you can imagine, without seeing any patients, there was a huge economic impact. And you saw that large Christmas photo of all of our staff Well, unfortunately, we've had to furlough our staff down to 4 currently within the clinic. We only have 2 doctors in the clinic each day at this time, and we've decreased our clinic hours down to 9 to 3 every day. Obviously, our medical approach dealing with this virus is an ongoing challenge because every day there's new information as to the pathogenesis, the diagnosis, and the treatment, and how to keep both our patients and our staff safe through these times. And now in this ramp up phase, how do we now start bringing everything back? So those are just some of the challenges that we've been facing with this pandemic onset. Now, one of the blessings that's truly come through is telemedicine. For us, we had not been doing any telemedicine, but telemedicine for us truly is a silver lining in these difficult times. Time and again, when we would be out giving talks about faith and medicine as part of our evangelization mission, people would come up and say, "Oh, when are you going to build a St. Gianna Clinic here?" And we would just smile, knowing that it's always in God's time. But telemedicine has made us one step closer to being able to do that, because now patients across the entire state of Wisconsin, because we're located in Green Bay, Wisconsin, can actually receive care via telemedicine for many medical conditions. And it's been remarkable. And we are getting the word out, and we are taking care of patients. An example, for example, was we had a patient who had a history of miscarriages. She found out she was pregnant during the pandemic, could not travel, and we were able to treat her. So anyway, telemedicine, huge benefit. Challenge is to maintain that patient experience, but we're working on it. So through these difficult times, God provides, and we know that. But what I want to say ultimately is that Catholic clinics combined with telemedicine are the ultimate answer, because people are still searching for that in-person encounter, for that connection, for compassion, love, joy, and for medical care that they can trust, for that something more. And Catholic clinics are that something more. They are something that people experience that is a true expression of the very best of our Catholic faith, of the beauty of the love that our faith transmits, and that really reflects our Lord Jesus Christ. We provide holistic, faithful approaches to patients' medical conditions, and they are touched by that, and then that is transmitted from one patient to the next. And so I believe with all my heart in these extraordinary times that the answer to these challenges is to build these clinics, to support them, to spread them throughout our country, so that we can return patients to that loving, faithful approach to medical care, where God is at the center, where God is the healer, and we provide that body, mind, and soul approach so that patients are healed and whole and can live out their call from God to do whatever they're called to do, and to bring Jesus to others through their lifetime. And I know that together we can make that happen. All of you on this call, all of these amazing organizations that have been brought together, we can make this happen. And again, medical clinics, Catholic medical clinics, are so much more than just a medical clinic. They are a true encounter with Jesus Christ. And I pray that we can bring that to as many people as possible in our country. Thank you.
Thank you so much, Dr. Goldsmith. And yeah, it really is, hopefully we see more and more of these clinics growing across the country. And there's a huge need and a huge underserved population, I think, there as well, of people who are looking for faithful Catholic care that respects their freedom, conscience, and treats in an authentically Catholic way. So next up, we have Dr. Rusty Chavey, who will be joining us. Dr. Chavey, are you able to? There we go.
Yep. All right, thanks, James. I am going to share screen and show some slides. I look better when I have my slides in front of me instead of me. There we go. All right. So Dede and Robin and I spoke in Denver several months ago, and we talked about what we were calling reimagining Catholic healthcare. And the reason we use that title is that I'm not sure that in today's world, very many of us have an idea of what Catholic healthcare can be and should be tied to its historical traditions. And we think that we can bring that back through these Catholic clinics. So let me talk a little bit first about what Catholic healthcare looks like in 2020. First of all, it's a big portion of our healthcare system, such that 1 out of 6 hospital beds in the country is in a Catholic healthcare system. That said, I don't think very many of the Catholic healthcare systems have a clearly evident charism around what their healthcare provision ought to be. And while it's easy to fault them for that, I think it is incredibly difficult to be a large Catholic healthcare system and truly manifest your charism in the way you perform it and stay competitive. That said, that leaves us without what is truly Catholic healthcare if the health systems, the large health systems, are all that we have. Another problem with the Catholic systems is that if we think about the components of Catholic social teaching, one of them is the common good. And in the large systems, the proportion of charity care is really not different than that of other secular hospitals. ERD adherence, the ethical and religious directive adherence, is problematic in these hospitals. And the other part is that these systems are large and they need to recruit physicians. They need to recruit competent physicians. Very difficult from a small pool to recruit excellent Catholic physicians. So many of the physicians in these large systems have never been trained in what it means to provide Catholic health care. Another challenge is that these health systems are large health systems really focusing on hospitalized patients. And that misses the most foundational aspect of healthcare, which is primary care. Finally, I think in today's world, many of our patients aren't even sure what is unique about Catholic healthcare. And apart from end-of-life issues or women's reproductive health issues, I think most of the laity is confused about what the value of Catholic healthcare is. So we believe that these Catholic clinics can help us reimagine Catholic healthcare. You're hearing from 3 of us today affiliated with Bella, the Emmaus Clinic, which is my clinic in Ann Arbor, and Robin's Gianna Clinic in Green Bay. There are a number of clinics like this that have cropped up around the country. And as our church is heterogeneous, so is the identity, the Catholic identity of these clinics. For some, their Catholic identity is wrapped in with the women's reproductive health. For others, it's service to the vulnerable, and they may be providing free care. For some, it's primary care. There may be others as well, but there's not one way that these clinics have maintained their Catholic identity. One thing that we almost all have in common is that the financial sustainability is a challenge. There is a reason why there are not very many private primary care clinics left in the country, and that is because that the business model and the revenue stream that comes from the insurance companies is really not very favorable for that. So for these clinics to remain independent, that's a challenge. One thing that I will say is that in contrast with the large systems, the clinics have been able to remain faithful and with fidelity to Catholic social teaching and to the ethical and religious directives. And that allows for untethering the identity of Catholic healthcare to be Catholic hospitals. In other words, we can reestablish a place in our community where people can see that Catholic healthcare in its entirety and in its fullness can be practiced. This is a slide I had put together just to compare the 3 clinics for those of us who are presenting today. I'm not going to spend a lot of time on this. This just gives you an idea of the size of the clinics and types of care that we're providing, and we all were founded at roughly the same time. Now I'm going to talk a little bit about examples of Catholic primary care. As I said, I think it is easy to think of Catholic healthcare as one, either being that care that is provided in Catholic hospitals, or two, healthcare that respects the church teaching around reproductive health issues and end-of-life issues. But the reality is, and frankly, the expectation should be much greater than that. I'm going to talk through 4 very quick scenarios here. First, my grace is sufficient. I saw a patient in my office and did his physical. At the end of the physical, he said, Dr. Chavey, I just want to remind you of something you said to me a year ago. Of course, that always puts you on edge. You're not exactly sure what you said a year ago. But he said, I expressed to you my concern that my wife is 10 years older than I am, and I was very worried about what was going to happen if she died before I did. And you said to me, my grace is sufficient. For the past year, he had been focusing on that verse of scripture, and he had even made that the focus of his men's group. I had forgotten that I even said it, but for him, that was an incredibly important piece of advice that he had meditated on for the past year. Frankly, it challenged me to meditate on it as well. Image and likeness. We tell all of our new patients when they come in that part of the reason we were founded was to make sure that we were focusing on each and every one of our patients as being made in the image and likeness of God. One day I was going to see a new patient, and my medical assistant tugged on my coat sleeve and said, image and likeness. I looked at her and I said, what do you mean? She said, room 3, image and likeness. So I went in room 3, and as soon as I opened the door, I knew what she meant. Here was a patient who was obese. He had poor hygiene, holes in his clothes, and I could see right then and there, as soon as I walked in, that he had probably been at the margins of society for most of his life. I was incredibly grateful to my medical assistant for providing me that reminder. She settled. I had another patient who came in one day and was talking about his divorce that was pending. And I had joked in the past that no one comes into the doctor's office and says, yeah, we've had marital problems and they're all my fault. But when he came in and we were speaking about his marital problems, and we were doing so just for me to get a comprehensive understanding of this patient. And he said, yeah, my wife settled. She never really loved me. And as a manifestation of this, he was drinking, he was having extramarital activity and so forth. But because we had identified our clinic as a Catholic clinic and with the understanding of what that meant, I felt I could go deeper with him. We talked about his going to confession. We talked about his being able to stop the extramarital affairs and to cut back on his drinking. And I'll tell you that he has made many of those changes, and he's actually doing pretty well at this point. Finally, faith and reason. There are a number of opportunities that we have in our office to talk about faith and reason vis-a-vis primary care. Vaccines are one of those, end-of-life issues, and even now COVID. So I think there's many examples where Catholic primary care is much greater than what those provincial thoughts might be. So Catholic clinics as a solution, I think Catholic clinics, if we are like Robin's Clinic in Green Bay, tethered to a Catholic healthcare system, they provide margin. Catholic clinics, while struggling to make ends meet on their own, when they're part of a health system, they actually do well and they generate a lot of revenue for a health system. Also, primary care reduces costs in a community. The more primary care you have, the lower the costs. Catholic clinics are also part of mission. I think we can extend the mission of the church incredibly with our attention to the principles of Catholic social teaching, with our attention to the ethical and religious directives. And I truly believe, as I know Robin and Dede do as well, that we can reinvigorate the ethos of Catholic healthcare and redefine it, re-image it, if you will, for the community. Finally, let me talk a little bit about COVID and primary care. And you can see on this slide, I basically put on one hand and then on the other, because no one really knows how we're going to emerge from this pandemic. One thing that I think is important to know is that we will emerge from the pandemic. but we will not emerge from COVID. We're going to have to learn to coexist with COVID in some way. So on one hand, COVID has put pressure for centralization of healthcare. There has been criticism among healthcare leadership around the governmental response to this, and some people saying this is exactly why we need centralization of healthcare. So there are pressures in that direction. On the other hand, there's pressures to allow for innovation. Robin talked about telemedicine. We had been practicing telemedicine in our clinic for years. The uptake was slow. I think there were a number of reasons for that, but a lot of the insurance companies were not reimbursing for telemedicine. Medicare was not allowing for telemedicine except in certain situations. So there was a lot of regulation and a lot of impediment that was there for telemedicine to take off. Yet in the last 2 months, telemedicine has grown tremendously. So if you remove those government factors, you remove those limitations, I think you could see innovation in a lot of areas, not just telemedicine. My second line, private practice. Are we too small to succeed or too nimble to fail? So in some data that's come from the American Academy of Family Medicine, if you look to the right, 85% of private practices are now using virtual visits. This was a blip on the radar screen 2 months ago, but now 85% of practices are using this. So it is incredibly important to be nimble. Nobody predicted COVID as it is manifest, but there are a number of other factors that come up. Having the ability to be innovative, having the ability to respond is incredibly important. Private practice is able to do that much easier than large health systems. That said, looking at the left side, are we too small to succeed? 50% of practices, reporting to the American Academy of Family Physicians, have not received revenue for telehealth in the last 4 weeks. Of those being paid, over 60% are reporting lower reimbursement for virtual care than they were getting for inpatient care or in-person care, and 28% have reported increased administrative functions to allow for that. Those are costs that small practices really have a hard time absorbing, whereas larger systems can absorb those a little bit better. Technology. On one hand, technology can be viewed by people as impersonal, undermining relationships that are the essence of Catholic healthcare. On the other hand, as Robin was reporting, telehealth and technology allows for scaling Catholic healthcare in ways we hadn't dreamed of. We have a naprotechnology doctor in our office who does naprotechnology consults for several states around the area. So while it might not be ideal, it certainly allows us to scale our product in ways that we otherwise would not. Finally, on one hand, I think the COVID crisis has resulted in greater distrust of the healthcare system. You don't have to look at very many of the videos around conspiracies or other concerns about how our centralized response has been rolled out to understand people's distrust. On the other hand, we have signs all over the place that say, thank you, essential workers. Gas stations are providing discounts for people in healthcare, et cetera. So in terms of COVID, I think it has resulted in some distrust of the system, but a greater appreciation and a greater trust for those of us who are actually working in the field. Thank you very much.
Thank you so much there, Dr. Chavey. Now I'd like to introduce Dede and invite her to come on. And she'll continue the conversation. And then afterwards, there'll be a few minutes for questions and answers. And we've got some great questions out there. Unfortunately, I don't think we're going to have time to get to all of them, but then hopefully we'll be able to address a number of them. So thank you.
Well, thanks all of you. Thanks for all of the participants taking time this morning on a Saturday morning to engage about Catholic healthcare. My daughter and I started Bella. We opened about 5.5 years ago, similar times to the St. Gianna and the Emmaus clinics. And each one of us, I think anyone who's in a situation where they feel called to open a clinic, there's something that pushed that, something in the Holy Spirit that moved our hearts to do that. In the case of Bella, our family coordinates medical missions to Peru, and we were in the high Andes of Peru, finished a very difficult mission. And my daughter and I, both nurse practitioners, were on the roof of this very broken place where we really felt the Holy Spirit say, I need you to take this care back home. And it was one of those moments where understanding that the Lord was asking us to be Him in our care, but back home in the environment outside of Denver, in the suburbs of Denver. And we brought that home. We talked with Archbishop Aquila. We had been discerning for some time, and this was the kick in the pants that said, make this happen. But the difference is he was talking about Christ-centered care. And that's what Robin has talked about, what Rusty has talked about, and what, even as we look at our other speakers this morning, what we've all talked about is having Christ the center of our lives and all the things that we do. And when we're talking about the most intimate parts of our bodies, our very selves, the things that we worry about, because it's us in a way that we only know, and to have the person who cares for us medically understand and hold that in dignity, hold that in such a sacred space, that it matters. That when we go back to Robin and the patient saying, it's so different when we're cared here, the care feels different. We see the same thing at Bella. I know Rusty and his team see the same thing at Emmaus, as well as the other Catholic clinics across the country, because Christ-centered care is delivered where we are just the vessels, and we are allowing Christ's love to reach the patient, where we are praying with all our hearts that we are less and He is more, and that we can see Him and our patients. And that's exactly what the Lord was calling us to do in Denver as well. And so 5.5 years ago, we opened, and we started as a women's clinic. We started as Bella Natural Women's Care. We were building on the natural and ecologically green approach that Colorado has anyway. But also that's very much how Catholic healthcare works. We find the best and least invasive but most natural ways to cooperate with a person's body. And that's exactly what we wanted to do. Well, when we opened 5.5 years ago, we had no idea that we would grow like we did. Archbishop Aquila definitely did. He said, you will be amazed what will happen here. And we did. We grew so fast, and very soon we had men coming and saying, will you please take care of me today, only today. And we were having a plan to add family medicine in the future, but we ended up by sheer demand adding family medicine within 2 years after we opened. And now here we are at, in 5.5 years after we've opened, with over 10,000 patients. And we find ourselves just like everyone else in the middle of a pandemic. We were just hitting our stride as a nonprofit, different from Emmaus, different from the St. Gianna Clinic. We are a private practice, but we are a nonprofit under the United States Conference of Catholic Bishops and the Archdiocese of Denver. We tucked ourselves under that wing as we were opening prior to Obamacare, and not knowing what that was going to entail for a Catholic clinic. That has been a safe place for us to hang out, by the way, as a nonprofit under the church, but with a very thick veil. We operate very independently. But as we are coming into this period of time with the pandemic, and just like everyone else, I mean, as Robin was describing, you're hitting your stride, you're running well as a clinic. In our clinic, we had 3 doctors and a midwife, 6 nurse practitioners, and a total of 38 employees. We have 2 satellite clinics where we serve the poor. And we were running in a great stride. And in that moment, in early March, we really had to stop on a dime and make some really tough decisions. First and foremost, what are we going to do? We're a full service comprehensive clinic that provides full family medicine full women's health care. We take care of children. We take care of those with infertility. We also provide NAPRO technology. We have a NAPRO fellow as one of our OBs. And we had a lot of people with a lot of needs, and yet we were in the midst of needing to make tough decisions about how are we going to care for the sick, how are we going to continue to care for the well. And just like the other clinics, those well visits, those non-essential visits, those surgeries, those elective procedures dropped immediately. And we too were faced with sustainability questions. Overnight, I remember on March 16th, ordering my Zoom healthcare account. And the healthcare accounts have a lot of firewalls, so it can keep people safe in that. But ordering that on a Monday night and starting it on Tuesday, 1 week later, 51% of our visits were telemedicine. In the midst of all of that, we also had to make a decision. How are we going to keep, just as Robin was saying, how are we going to keep our patients safe? How are we going to keep our staff safe? And what are we going to do about healthcare? How are we going to respond as a church with the heart of a Catholic responding to this crisis? Well, what we decided, and it just kind of came out of need, we had a person that needed to be screened for COVID. And at that time, we were allowed 5 swabs a day from the lab, and we had to make that decision. Well, we saw her in her car. That's where we started. Is we saw her in her car, we evaluated her, we sent off her labs. Then from there, the Lord just put upon my heart, you started in a mission. You started basically in a parking lot with people lined up. Now, I knew I couldn't have people lined up because we couldn't have people congregate. So for us, we created a drive-through clinic. And now we see all people who are not well. So anyone who has any kind of illness, we will see them in their cars in the parking lot. We schedule them as a regular appointment. That is in rain, in snow, in 85 degrees. It doesn't matter. We're going to see them. I was in a meeting yesterday, but I got a picture of one of my nurse practitioners actually seeing a pregnant patient for an OB visit. And I have my nurse practitioner kneeling on the concrete, evaluating this patient in her car for her OB visit. And it was so providential to see one of my practitioners basically kneeling at the foot of a patient and bringing the love of Christ to the patient is very moving, because that is what we do in Catholic healthcare. Now, moving forward, we aren't sure exactly what this looks like. For right now, we're going to continue. We'll continue seeing sick people in the parking lot as long as we need to. We have registered 515 new patients in the last 4 weeks. Now, that's actually pretty phenomenal for a small medical practice. And yet, what we're finding is not only are people just really fearful, just as Teresa was talking about, people so fearful about COVID that to be able to receive the comforting words that they don't have COVID, or in so many cases that they did have COVID. It's beautiful to be a part of that. So our office is testing. We test by nasal pharyngeal swab, and we also test with antibody testing. And we've done about 600 antibody testing. Our clinic has about a 20% positive rate for the antibody tests. And our tests are very well validated. We use a rapid antibody test that has been used by, it's one that's used by University of Southern California, by LA County, Denver County, Johns Hopkins. Many, many places have used the same manufacturer, and that test has been very validated. What is such a relief for so many is when, as I said, when they have had COVID-19, and they come back with a positive IgG, which is your more permanent immunity, as we know, hope and believe with the information that we have. And so that has become a part of our daily lives. I know that we will continue to test for COVID as long as we need to. And just as Rusty had said, is that we are in a moment of time where this will change all of our lives forever. I mean, this is not at all what we had imagined for Bella, but what we had imagined and what we knew in Catholic healthcare is that we would stay there. We would stay and be first on the field. We would be those people that would respond as the need required. And in this moment in time, when so many clinics, so many medical practices, multi-specialty practices are closing their doors, and it is quite honestly because of money. Insurance reimbursements, especially for telehealth, are very, very low. And patients aren't coming, patients are fearful, procedures are decreased. This is a moment in time where financially it is very, very hard on the clinics, but it's also a moment in time where we that are in Catholic healthcare can reclaim our space at the front of the line. We can reclaim what Catholic healthcare needs to look like, what Christ-centered healthcare looks like, that we can bring dignity to the bedside. And as the Catholic providers in this country, I would challenge anyone who is a provider to say, what can I do? I may be limited by the system for whom I work, but what can I do to promote Catholic healthcare and move it to the front of the line? How can we have life-affirming care from conception to natural death be the primary concern for all in our care, in all that we deliver and how we approach care, and all those moments from conception, between conception and natural death, all of us who are in between, who deserve dignified, life-affirming care. We need to ask ourselves, what can each one of us do to promote that? And how can COVID-19 be that opportunity that the Lord has given each one of us, that opportunity to embrace one another as families, to thank the Lord for our health and for all that is good in our lives, and to also say, I am not afraid. I am not afraid. I am not afraid of this virus, and I will move forward to do what I need to do to help people be whole. That's what I would like to leave with each one of us, is that, yes, this is here. And when COVID-19 has diminished in all the media and the bigness and in the way that it has totally overcome our lives, something else will follow. And just as with COVID-19, what I just want to say is we are ready and we will respond. Thank you.
Thank you so much, Dede. And I'm going to bring Dr. Rusty and Dr. Goldsmith back on here. And we're a little bit behind on our time here, but so we have a little bit of time for some questions, but hopefully, we have a number of great questions out there. I don't know if you guys are able to see the question and answer section, but one question that was brought up, and I think Dr. Padilla would be able to answer that later on, is what difference does it make that you have a Catholic doctor? Why should people choose a Catholic doctor? But another question is, what is necessary for there to be more Catholic healthcare clinics like you all are doing, and what is the potential with different hospitals acquiring clinics and consolidation of healthcare into some of these bigger systems? How do we build these clinics, and how do we make more of what you are all doing available across the country? And is that a future that's possible and foreseeable?
So I'll go first. I'm also going to address one of the questions that was there was, how about people who don't have the capabilities for telehealth? Currently, at least, many insurers are paying for telephone visits, not just telemedicine, which includes video. So you could speak with your own private physician about whether they're doing that in their state. Medicare is covering that, so that is an option. One other quick comment about that is that medicine is still governed by state boards of medicine. So you are not allowed right now to practice telehealth, whether it's telephone or telemedicine, across state lines unless you have a license in the state where the patient is originating the visit. So there are some limitations there. Rob and I may be able to talk some about what is going on to try to expand these clinics, but we are all working, Dede, Robin and I and others, all working with the Catholic Medical Association to try to find sustainable business models for these clinics. Some of that may be in partnership with large health systems. Some might be in partnership with business. I think there's some creative ideas that we can come up with. We still are limited to some degree by the handcuffs put on us by the insurance companies. That's not to say that there aren't models. I would also like to plug, there's a product called mycatholicdoctor.org. One of our colleagues, Dr. Kathleen Berkelman, has put that up. And she has physicians in 49 of the 50 states who can provide Catholic medicine via telemedicine through her portal. So you could look there as well.
I'll jump in next. Thanks, Rusty, on two things. First, regarding being a Catholic doctor, what's the difference? In concise form, I can tell you that the more I incorporated and deepened my faith, the better that I heard my patients and the better that I could care for them and take treat them in the very best possible way. That was what I noticed, first of all, that I actually heard what they were really concerned about, what really mattered to them, because so often they present with an entirely different complaint than what they're truly concerned about. Second, my diagnoses, my impressions, my treatment plans are completely affected by my deep-rooted beliefs. As an OB anesthesiologist, I cannot tell you how many times, and even in our NAPRO technology patients, how many times the recommended treatment to a high-risk OB patient was to have an abortion. And time and again, our group, being adamantly pro-life, viewed both of those patients being equally deserving for the opportunity of life. And each and every time we would take care of both of them, and God provided, and by the grace of God, they both made it through. So I can give you countless examples, but I do think with our Christian brethren that the end of life issues that are rising, that I think that is a way to connect with them, to help them understand that Catholic doctors, nurses are much more. It's not just contraception. I think that's the hang up so often, is the contraception issues. We are an all life medical profession, and now the end of life issues are making that much more apparent. Regarding these Catholic clinics, there is always a way, and I do feel more than ever, I truly believe this is what God is asking us to do throughout this country. I know that bringing together the greatest legal, medical, theological, and business minds can make this happen. Our model is sustainable and replicable. You have Dede and Rusty doing great things. There are other clinics. The CMA absolutely is, we're members of that, are working on this. This can be done, and it not only can be done, it has to be done, because these clinics are what are going to save Catholic healthcare. I cannot say that more emphatically, because most of our care is given through clinics anyway, 70%. And this is where we can change the fabric of medicine, where we can return our culture back to the culture of life, and where we can give this life-saving and life-giving care. It can be done, but it requires the best of those minds to develop those models. But we also need, the reality is we do need financial support. We do need philanthropists and others, and we need people of faith and no faith to become patients and support us in that way as well, because it can be done. With God, anything can be done. All things are possible. So those are my thoughts.
And I'd like to just add just really quickly one, just that I know that temporarily regarding the telemedicine that we can practice medicine temporarily across state lines in this moment when things are being, some of the regulations are being did a little bit. I know some people have added that in on some of their questions, just clarifying. So I have seen that. I can't agree with Robin enough in terms of, as a Catholic provider, I see this with all of our providers in our clinic, that first of all, the Lord has given us amazing gifts, and the competency is important to have a well-informed, well-educated, and up-to-date provider is important. But to have that provider know that this is not on them, that there is a God who is much bigger and who can lead them and knows a whole bigger picture of things that we don't always see. But when we can give people the time to tell their story and we listen to them long enough to hear what they need, it does influence how we care for them. And when we allow the Lord to move us, then we are making the right decisions in their care.
Fantastic. Well, thank you all. Unfortunately, we're going to have to move on to the next segment. There's a lot of great questions, a lot of great comments as well in the chat. I would, Doctor, if you are a provider, and you do have some questions, I would recommend reaching out to any one of the panelists here as well. Dr. Kathleen Birchelman has put some comments there in the chat, which are really helpful as well. My Catholic Doctor's helping doctors set up telehealth practices if they're members of the Catholic Medical Association, and also, if they want to practice through My Catholic Doctor, I would definitely recommend reaching out to her. So thank you all very much. And if we have time at the end, I hope maybe we can bring some